This portion of Local Lifestyles is sponsored by Owensboro Health.
96 million Americans have prediabetes, and yet most don't even know it. Beth Cecil is a registered dietitian, nutritionist, and associate director of Owensboro Health Medical Group. Good to see you, Beth.
Hey, good morning. Thanks for having me.
Thanks for matching.
I know.
Look
We didn't
at
even
us.
have to plan this.
Great minds, great minds.
Yes.
So, what is prediabetes, and how would we know?
Yeah, well, first of all, you don't always know, and that's one of the things that makes it so tricky. But prediabetes is when your blood sugar runs not quite normal, but not high enough to be considered true diabetes. So there's kind of what I like to say, a window of opportunity, because the good news about prediabetes is that you can reverse that. But prediabetes can turn into full-blown diabetes, as we know. It's also a risk factor for heart disease, stroke, kidney disease, other long-term chronic conditions that we hear about that we don't want to get. So prediabetes is that people used to say borderline. We don't really refer to it now as borderline, so it's prediabetes, but you're not there yet.
But you can, as you said, the word of hope here is that there are action steps we can take to reverse that. So what are we talking about here? What are some of the things we can do in our daily life?
So it's really not even that difficult. It can be just increasing our physical activity a little bit, and it doesn't mean you have to go out and run a marathon. It could just be, we were just talking about power walking, and it could just be getting out in the morning and doing a little power walking, or just working in the yard more, and then just doing less sitting around watching TV, things like that. Changing our diets, just moderately changing things a little bit, more fruits and vegetables, people are doing more plant-based eating, and then just a moderate weight loss. And those three things together have been studied and shown to reduce people's risk of developing diabetes, and even if someone has prediabetes, bringing their blood sugar back into that normal range.
You know, as I listen to you talk, if you think about it, if you are pre-diabetic, you're not at home sticking your finger and checking anyway.
No.
So you wouldn't even know.
You don't know, and that's the thing about it. People know that they have, almost everybody knows somebody that has diabetes, and that we know people have to stick their fingers or give themselves shots, and there's a lot of advancement now today, but we still don't want to do that. So people can have prediabetes and not have any idea unless they have had their blood sugar checked by their provider, or we do have a risk test that you can actually take, and it's available at the CDC website, and it will tell you if you are at risk, and things like whether you're male or female, your age. Of course, as we get older, we get at risk for everything. It seems like
I hear that a lot these days.
I do too. I feel that way. But anyway, and then also if you've got a family history, or females who had gestational diabetes are actually at higher risk of getting prediabetes or developing diabetes as they get older.
Well, all right, we want to learn about where we are with all of this. You have some classes coming up.
We do. We have the Diabetes Prevention Program, and Owensboro Health is one of the few areas that has a CDC recognition to offer this program.
Impressive, very impressive.
And so we are going to be having information sessions in August, the 24th and the 31st of August, and then we have a class starting in September. The nice thing about our prediabetes program is that and this is nationwide, but people that are Medicare beneficiaries, if they fall into the criteria, that is a covered benefit, so they don't have to pay. Owensboro Health also has a grant, so we are helping for those that may not be covered by their insurance, but really need this. So we also have some funding for grants, so for certain participants, they may qualify for that as well.
Is this found on the Health Park website?
Yes, okay. Absolutely.
Thank you, Beth. Yes. See you next time. I wonder what we'll be wearing.
What will we be wearing?
What would we be wearing, and who will wear it best? We'll be right back. Stay with us.
This portion of Local Lifestyles is sponsored by Owensboro Health.